Coming up on the show, Dr. Julia Carroll will be joining us to demystify the vampire facial. A lot of people saw when Kim Kardashian tweeted something out. It's not that. It's something entirely different. Okay. So she has done it on someone, and it takes a while to take effect. So we're going to see the before and afters, and she'll explain how it works.
Would you try it?
Oh, I tried it.
Yeah.
I'm like, can I please try it too? Because I have always been very, very dark under my eyes. Okay. Have you noticed that it's... You know who's noticed?
You're always gorgeous to me.
That's the right answer. You know who noticed was Jessica, our makeup artist. Okay. When she was like, it's just ever so subtly not as deep.
I can't even get my blood taken, so I can't. So this, you're literally taking some.
You are. Blood that's the vampire part of the story. We'll get to. Yeah. There'll be nothing gross though. Don't fear for your cereal.
No. They're curious right now. If I was watching, they're like, get the darkness out of my eyes.
Yeah. Really. What?
Yeah.
Dermatologist Dr. Julia Carroll is joining us now. Good morning, everybody. I'm Liza, and you're watching The Morning Show here on Global. Good to see you.
Nice to see you.
So, a while back, Kim Kardashian tweeted out this picture and said, here's me getting a vampire facial. Now, here was the look, and it looks like there's blood all over her face. So, of course, everyone becomes curious. What is this? Right. Is that even a vampire facial?
No, it's not. So this infuriated me as someone who's been doing this procedure in my office for a few years now. I think she had some derma roller done where she had little tiny holes put in her face, and then they dripped something on her face that is part of what we do with the vampire filler, but it's not red, so I have no idea what she had going on there.
Yeah, that just looked crazy. And then, of course, when I saw that picture, I started to Google it as well. I never saw anything remotely like that. So, what is it?
So what it is, it's called platelet-rich plasma. So we take blood out of the patient, and then we purify it, and we take out the red blood cells, and then we have this beautiful platelet mixture that has all these extra growth factors and everything in it, and then we re-inject that.
Okay, so this is you. This is someone in your office.
Yeah, this is my, she's actually, she's a great patient of mine. So we're taking the blood out.
Right.
And we had put some numbing cream on beforehand just to make sure that she didn't really feel much of anything.
And so how much blood are you taking?
So this is us purifying it here. We like to get, if we can, between 4 to 8 cc's of blood. Okay. So there it is with the red blood cells in.
Like one of those tubes. Okay, so this is a centrifuge?
Exactly, yeah, correct. And so we're spinning it, we're separating the red blood cells out. So we're purifying it just to get that platelet-rich plasma. And then she's just using a little ice pack to try to reduce any chance of bruising.
And what result is she hoping for?
So this procedure is not for everybody. You're getting a very subtle result. So she doesn't like the hollowness under her eyes. There she is before and after. The fine lines, even some of the dark color that you get under eyes, can improve. So I think that's a pretty good result.
I do too, and I'm a big believer in that as well, that you just want it to be subtle. Oh, I see that a lot.
Yeah, so this is someone who's actually had the procedure done 2 times, the full procedure done, and this is a few months out.
And we knew, I don't know if we have any more B-roll, but of course we don't want to scare people when they're just awaking to the world. But you do, once you have those platelets separated, it will be re-injected.
Yeah, so we re-inject it under the eyes.
All around the eye.
So that's the thing. It's actually, it's a filler. So it's in the same category as a Juvederm or a Restylane, but a slightly different result, a slightly different process. But we're using it for areas we want to fill in. But this will also improves the texture in the area. It's subtle, but what people say is, I used to be really obsessed with my eyes and makeup, and now I don't worry about them anymore.
Well, full disclosure, when I found out we were doing this segment, that's my area. Yeah. Where I'm deep under there. It's partly genetic, partly never getting enough sleep. Yeah. And so I said to Doctor, I'm like, can I try it? And so
you were an excellent guinea pig.
Yeah, and I mean, it hurts a little. Well, it's a needle.
It's needles, yeah.
Not terrible, but you feel it. And I have noticed, and I've only had it done once. He said twice.
Yeah, so we need to do it a second time. And the other area besides under the eyes, too, that I love is these little tiny little necklines. So I like this for areas where I don't have another great product for it, and this works well for that.
Now, won't this just reabsorb back into your system the same way that a Juvederm does, or whatever?
It does. Well, so it's really neat the way the technology works is that, or the science works, is that platelets. So if you cut yourself, you start to claw it off. You can see, a scab starting to form, and platelets are what start that. So we take the platelets, we put them in the area, and your body thinks, oh, there's a wound going on here, and it starts trying to make everything to try to repair a wound. So it tries to make more collagen. It tries to make more of your skin cells. So we're trying to tricking the body into producing all these things. So once it's there, it's going to last as long as a normal skin cell would or a normal piece of collagen would. There's just a bit more there. So
okay.
Yeah.
So it will last for quite some time, but eventually, as the
lasts
body
about 18 months, they say the effect. Yeah, 12 to 18 months. Yeah.
And you would be doing this then for the rest of your life, if you like what you're seeing.
If you like what you're seeing, yeah. And
so why wouldn't people just shoot it in their whole face?
Well, they do. So I mean, we're actually
Do they?
Yeah, we're looking at different ways we can use it. So if we do a laser procedure that creates sort of little pores in the face, we're looking now at can we then add this on and what does that do? So and the other thing people use it for from before we started doing it for cosmetics is for joints. So Tiger Woods has had this done to repair a joint in his knee.
Well, like so many things, Botox wasn't used cosmetically, right? It was used for migraines, right?
Yeah, Well, it was used for eye spasm, migraines,
Right.
Yeah.
And then they noticed this cosmetic result. So is that the same idea where it was for sports injuries?
Yeah, so they looked at for sports injuries, and they thought, well, if it does that for a joint, for cartilage, what can that do for collagen?
Right. Well, thank you so much for coming in, Dr. Julia Carroll. She's a dermatologist. Do you guys call it the vampire facial?
It's called Selphyl. But trendiness we like to call it the vampire filler.
There you go.
Yeah.
Thank you so much, Dr. Carroll. We're going to take a break. We'll be right back.